In this podcast episode, Dr. Sasha Hamdan, a board-certified psychiatrist and ADHD specialist, shares her insights on ADHD, emotional regulation, trauma, and the intricacies of diagnosing and treating focus-related difficulties. The conversation spans genetics versus environment in ADHD causation, the distinctions between ADHD presentations, medication and behavioral treatment approaches, emotional sensitivity, rejection sensitivity, dysphoria, and how modern society impacts mental health. Personal stories and practical advice for parents and individuals finish the wide-ranging discussion. Dr. Hamdan clarifies a common misconception about ADHD's root cause, emphasizing that genetics is the primary factor rather than trauma or environmental adversity. While trauma, PTSD, anxiety, hormonal changes, and medical conditions like thyroid dysfunction can cause fragmented attention and behavioral challenges, these symptoms are not true ADHD. ADHD is a distinct, longitudinal pattern largely rooted in genetics. The fear that trauma causes ADHD can sometimes hinder proper evaluation and treatment, especially when parents hesitate to seek help due to guilt or stigma. Distinguishing ADHD from other causes of focus fragmentation involves a thorough assessment of medical, psychiatric, and psychosocial history, tracing symptom patterns from early childhood onwards to identify consistent traits versus context-dependent challenges. The terminology around ADHD has evolved. What was once called AD is now classified under ADHD, which includes three presentations: inattentive, hyperactive, impulsive, and combined types. Inattentive symptoms involve difficulties initiating and completing tasks, forgetfulness, and disorganization, often seen in daydreamers. Hyperactive impulsive symptoms manifest as physical restlessness and verbal impulsivity. Combined type shows features of both. These distinctions help identify ADHD in diverse individuals, including those who may not fit the stereotype of hyperactivity, such as many women and adults who have learned coping mechanisms masking their symptoms. Diagnosis involves gathering data from clinical interviews, neuropsychological testing, and input from parents or teachers, emphasizing longitudinal patterns. Dr. Hamdan expresses dissatisfaction with the term attention deficit hyperactivity disorder, suggesting it insufficiently captures the core issue, regulation difficulties. She argues ADHD fundamentally involves regulation, not just of attention, but also motivation, energy, and emotion. Emotional dysregulation is common, but historically overlooked in diagnostic criteria, although it was added to European standards in 2019, not yet adopted widely in the US. This gap leads to misdiagnosis, wherein emotional symptoms are labeled as anxiety or depression without recognizing underlying ADHD. Treatment should be comprehensive, combining behavioral and lifestyle strategies with medication when needed. ADHD medication, particularly stimulants, can be life-changing for many, enhancing their ability to engage with behavioral modifications. However, medication is not mandatory for diagnosis or effective management. Dr. Hamdan stresses the importance of personalized care and warns against quick prescribing habits by some primary care providers. The conversation about treatment should always include lifestyle changes and behavioral management as foundational steps. Many people with ADHD or heightened emotional sensitivity experience rejection-sensitive dysphoria, a neurological condition involving intense emotional reactions to perceived or actual rejection or criticism. This hyperresponsiveness is driven by an overactive amygdala and an underactive prefrontal cortex, impairing emotional regulation and causing emotional avalanches that overwhelm cognitive control. Dr. Hamdan underscores that RSD exists on a spectrum and teaches that feeling deeply is not a flaw, but a neurological variation requiring specialized skills for management. Women with ADHD are often misdiagnosed with anxiety or depression because traditional diagnostic criteria are based on young, hyperactive boys, leaving female presentations underrecognized. Hormonal fluctuations, especially changes in estrogen affecting dopamine levels, exacerbate symptoms in women but may be mistakenly attributed solely to mood disorders. Additionally, societal expectations encourage women to mask or compensate for their symptoms, delaying diagnosis until adulthood when emotional or functional impairments become untenable. The current digital landscape and societal chaos do not cause ADHD, but can worsen symptoms and fragment focus. Screen time, especially excessive early exposure, fragments attention and may exacerbate underlying vulnerabilities. Dr. Hamdan supports moderate screen usage balanced with integrated play and movement, particularly in early childhood when the brain is highly plastic. She recognizes that technology serves as a practical parental tool, but cautions against its overuse and advocates for conscious moderation. The episode explores the neuroscience behind emotional regulation difficulties, particularly the interplay between the amygdala's threat response and frontal lobe's executive control. When overwhelmed, the brain's alarm system floods the body with stress chemicals, while the logical brakes remain underactive, leading to impaired judgment and heightened emotional responses. Dr. Hamdan shares personal strategies and examples, such as physical movement, e.g., doing squats, to stimulate brain function and calm the nervous system, as key tools tailored to individuals' emotional presentation styles. She emphasizes learning and practicing these skills in low-stakes moments for effective real-time regulation. Misdiagnosis can lead to a harmful cycle, especially when patients are repeatedly prescribed antidepressants for symptoms without recognizing underlying ADHD or emotional dysregulation. This not only delays effective treatment, but can worsen mental health. Dr. Hamdan points to the complexity of these cases and advocates for nuanced assessment to break these cycles. She recounts her own experience being prescribed ADHD medication as a child without a clear diagnosis conversation, reflecting on the emotional and academic challenges she faced before obtaining proper recognition and treatment. Rejection is an inevitable human experience, yet without effective emotional skills, it can lead to maladaptive behaviors like perfectionism and people-pleasing, or avoidance of meaningful relationships and goals. The discussion highlights how rejection sensitivity can cause people to prematurely end relationships or hesitate pursuing opportunities due to fear of failure or judgment. Dr. Hamdan encourages developing emotional literacy to transform sensitivity into strength and to maintain resilience. Dr. Hamdan discusses the importance of talking openly about emotions with children to build emotional regulation skills early. She exposes the challenges of balancing emotional validation with necessary boundaries and structure. Sharing personal experiences, she advocates for honest family conversations about feelings as a means to reduce fear and shame around emotions. The cultural context of fear of rejection also emerged in her own relationship story, where cultural expectations clashed with personal choices, illustrating how societal pressures can amplify fears of being rejected by family and community. Closing the episode, Dr. Hamdan shares 3 core truths she would leave behind: embracing emotions without fear, valuing time with loved ones as the most precious treasure, and leading with kindness even when the world expects harshness. These principles encapsulate her philosophy toward emotional regulation, relationships, and navigating life's challenges.